joints. What is a joint? These are two bones, which we'll call them as skeletal elements. Now, joint is the site where two skeletal elements meet. Joints are of two categories. The first category is synovial joints. Synovial joints. Synovial joints are joints in which the skeletal elements are separated by an articular cavity. Synovial joints are joints in which the skeletal elements are separated by an articular cavity. The first characteristic of synovial joints is that they're separated by an articular cavity. The second characteristic is that they have hyaline cartilage. Now, hyaline cartilage is present at the articular surfaces of the joints. These are the articulating surfaces of the bones, and they're covered by hyaline cartilage. This is hyaline cartilage. Now, the third characteristic is the presence of a joint capsule. Now, this joint capsule has two membranes. The first one is inner synovial membrane. Inner synovial membrane. Now, this inner synovial membrane, it attaches at the site where the cartilage joins the articulating surfaces. So, the site where the hyaline cartilage joins the articulating surfaces of the bones is the place where the inner synovial membrane attaches, and it forms the articulating cavity. Now, this inner synovial membrane also secretes a fluid known as the synovial fluid. This fluid helps in lubricating the joint. The second membrane is the outer fibrous membrane. Outer fibrous membrane. This membrane is the outer fibrous membrane and is formed of a dense connective tissue and stabilizes the joint. The joint capsule contains two membranes, the inner synovial membrane and the outer fibrous membrane. Now, another characteristic present in synovial joints is the presence of articular discs. Articular disc. These discs act as shock absorbents. They absorb the shock towards the joint and protects the joint. It also helps in stabilizing the joint. Another characteristic is presence of fat pads. Now, these fat pads are present between the synovial membrane and the joint capsule. So, these are fat pads. These fat pads are present between the inner synovial membrane and the joint capsule. Now, these fat pads can move in and out of the joint. They move in and out of the joint as the shape changes. Now, there are 7 types of synovial joints. 7 types of synovial joints. The first one is plain or flat joints. Plain or flat joints. The plain and flat joints help in sliding or gliding movements. sliding or gliding movements. And these joints one bone, just suppose that these are two bones and one bone slides across the surface of another bone. Example of flat joint is acromioclavicular joint. This joint is a part of the shoulder girdle, and we will discuss about this joint in the video on the shoulder girdle. The second type of joint is hinge joint. Hinge joints. So this is what a hinge joint looks like, and it permits movement around one axis. Movement permitted around one axis. And the movement is flexion and extension. Flexion, extension. These are the two movements that are permitted by this joint, flexion and extension. A very good example of this joint is the elbow joint. Elbow joint is an example of hinge joint. This is my elbow joint, and this is flexion, this is extension. Third type of joints are pivot joints. You can call it pivot or pivot. I call it pivot joint. This is how a pivot joint looks like. It also permits movement around one axis. It permits rotation. The example of a pivot joint is the atlantoaxial joint. Atlantoaxial joint. The fourth type of joint is bicondylar joint. It permits movement around one axis, and the movement is limited around the second axis. Now, two convex articulating surfaces, when they articulate with a flat surface, that's how this joint is formed. And a perfect example of bicondylar joint is the knee joint. Knee joint is an example of bicondylar joint, which is formed when two convex articulating surfaces articulate with a concave or a flat surface. The fifth type of joint is a saddle joint. This is how a saddle joint looks like. It looks like a saddle. It is saddle shaped, and it permits movement around two axes and a right angle to each other. Movements permitted are flexion, extension, abduction, adduction, circumduction. These are the movements that are permitted by the saddle joint, and a perfect example of saddle joint is a thumb. Thumb is a perfect saddle joint. It allows all the movements: flexion, extension, abduction, adduction, and circumduction. The sixth type of joint is condylar joint. This joint is also called ellipsoid joint. Ellipsoid joint permits movement around two axes, and the movements are flexion, extension, abduction, adduction, and circumduction. A perfect example of this joint is a wrist joint. Wrist joint is a perfect example of condylar or ellipsoid joint. We move on to the last type of joint, that is ball and socket joint. A ball and socket joint permits movement in all the directions. A ball and socket joint allows movement in all directions. A hip joint is a perfect example for ball and socket joint. The movements are flexion, extension, abduction, adduction, circumduction, as well as rotation. So these were the 7 types of synovial joints, solid joints. When two skeletal elements are separated by a fibrous tissue or a cartilage, that is known as a solid joint. So we have two subtypes of solid joints. Those are fibrous and cartilaginous. Fibrous and cartilaginous. Under the category of fibrous joints, the first one is sutures. These sutures are present between the bones of the cranium, that is, between the bones of the skull. These are two bones of the skull, and they're joined, or they're connected by a fibrous tissue, and this is known as the sutural ligament. The sutural ligament. Second type of fibrous joints is gomphosis. Now, gomphosis is present only in our teeth. So this is a tooth, and this is a socket. The tooth is connected to this socket through a fibrous tissue, and this is known as periodontal ligament. The third type of fibrous solid joint is syndesmosis. Syndesmosis. When two different bones are connected with a fibrous tissue, that is an example of syndesmosis. Radius and ulna are a perfect example of syndesmosis, because they are connected by an androecious ligament, which is made up of fibrous tissue. We move on to cartilages joint. These joints further have two subgroups, that is synchondrosis and symphysis. Synchondrosis and symphysis. Now, what is synchondrosis? Within a bone, now there are some bones that have two ossification centers. No, so within a bone, when two ossification centers are separated, when these two ossification centers are separated by a cartilage, then it is called synchondrosis. When two ossification centers within a bone are separated by a cartilage, it is called synchondrosis. This is a humerus. Now humerus has two ossification centers in the head. Now these two ossification centers are separated by this cartilage. And this is an example of synchondrosis. Now we move on to symphysis. What is symphysis? Symphysis is when two different bones are separated by a cartilage. When two different bones are separated by a cartilage, it is an example of cartilaginous solid joints. Pubic symphysis. Pubic symphysis is an example of symphysis. We will discuss about pubic symphysis in our later videos.